Welcome to Aging Insight with your host, John Ross and Lisa Shoalmire. This program is brought to you by
Welcome to another edition of Aging Insight. I'm Lisa Shoalmire, and I'm here with my partner, John Ross, and we are elder law attorneys based here in the Arklatex. The whole purpose of Aging Insight is to make sure you get information that you can use brought right into your own home. So we're wanting to provide that to you every week. Well, this week, our topic is something that, a lot of people run away from.
Mm-hmm. That's true.
Talking about the issues of aging and handling the challenges that come with aging, whether those challenges are financial or whether those challenges have to do with where you're going to live, or those challenges are even more basic, such as dealing with that chronic or terminal illness. Those are all challenges that if we're blessed with long life, we're all likely to face.
Oh, well, that's absolutely right. And as you get older and you have more health problems, you have more health needs, more health concerns, as you experience these sort of things, figuring out how to pay for yourself, how to get the care you need, where to get that care from, what is covered by Medicare, what is covered by Medicaid, what is covered by veterans benefits, what are you going to have to pay for out of pocket? All of these questions, are flooding in at the same time. And so, one of the keys, we've always said on the program is that, if you want to stay independent, you want to live on your own terms, you don't want to be a burden on others, you want to avoid going broke, you can do it, but you need knowledge. And that knowledge is the key to knowing, when the time comes and you start needing additional care, knowing what options are out there and not just dismissing something because of some misconception you might have. And that's really kind of where we're coming to today.
That's right. So today we want to talk about one of those resources, one of those options out in our community that can, be of assistance at the right time is hospice care. And John, when I say the term hospice, a lot of folks in the community or clients or, just even my own family, when you use the word hospice, again, they want to run away from it, not discuss it. They think that if we're mentioning the H word, then we've given up and we're admitting that there's a terminal situation and that's not the way to go. We should fight and we should, but there are a lot of benefits to hospice care and people just need to know about it.
Yeah, I have a friend who's an elder law attorney up in Seattle, and he's very well known up in the Northeast, and I listened to him speak one time, and his position was that hospice benefits, of all of the benefits out there, Medicaid and Medicare benefits and home health benefits and all of the different things that are out there, that hospice was the single number one misused or underused service out there, that people just didn't know what was available. And when you start looking at care needs and you're saying, well, I could probably use somebody to come help with some of my meds at home. Maybe I need somebody to do a little, help me bathe occasionally or some things like that in the home environment, because I don't want to have to go to a nursing home just yet. Maybe I'm having some trouble paying for the kind of drugs that I need. Maybe, my family is having a hard time coping with the illnesses that I have, and and I would like some counseling, some support for them. All of these sort of things. And all of those sound like great services. And if I said all of those services came from a palliative care unit, you might say, well, John, tell me more about this palliative care unit. That sounds like a great thing. But if I say all of this is provided by hospice, oh, you should see the look in people's eyes when they're sitting in my office. And I say, have you considered hospice? Because, when they hear that word, Lisa, they're thinking, John, I cannot believe you just told me I'm going to die.
Yeah, that you've given up on me.
That you've given up on me and that's it.
Well, and that's a big misconception. Hospice. First of all, let's talk about the financials, what pays for hospice care.
Right.
Because a lot of times people won't even, they think that care is expensive, I can't afford it, I'm just going to dismiss it before we even go any further.
Right. And so under your Medicare, and your supplemental insurance is coverage for things like home health care. So if you have, let's say you've injured yourself and you have a wound and you're at home and you need a nurse to come out and help you dress that wound once or twice a week, Medicare will pay for home health to come out and provide that kind of service. Medicare is also the what pays for hospice care. So hospice care is not going to cost you anything other than that Medicare premium that's already being deducted out of that Social Security check that you get.
So usually that's the first hurdle. The first thing someone throws up when I mention the term hospice is, well, financially that's just not that's not. But once we get past that, they don't have that excuse not to consider it further. Then we really get into the nuts and bolts of what hospice care can do. Well, and first of all, hospice care isn't for everyone, but hospice care is not just a benefit for those that are at the very end of life. And, John, some of the requirements for hospice are that, you do have a diagnosis such that, death is imminent in 6 or 12 month time.
Yeah, a doctor, in order to qualify for hospice benefits, a doctor has to certify that you have a disease or illness that could, notice I said could and not will definitely, but could end your life within 6 months. So you clearly have something that is terminal. Now, that doesn't mean that it's going to kill you in 6 months, or that it's going to kill you next week. In the hospice world, as people get very close to death, a lot of times they talk about that as actively dying. This is where you're in the last few hours, minutes, maybe a day or two away from it. And oftentimes this is when people, when they think about hospice, they think about people who are actively dying. And yet, if I told you that I have clients that go to church every Sunday, that drive themselves to church every Sunday, and yet are receiving benefits under the hospice program to help with some of those needs that they have in the home and some of these other things, that might surprise you. Just because you have a diagnosis that you have a disease that could kill you within 6 months doesn't mean you're going to die in 6 months. In fact, it's not uncommon for people to reach that 6-month mark and get recertified for another 6 months. In fact, I've heard stories of people who have received hospice benefits for 2 years. In fact, I've even heard stories, and if you talk to some of the hospice people, they will tell you, while not very common, they've even had folks who received hospice benefits and got better. So it's not for the actively dying, although that seems to be the one of the big misconceptions. The other big misconception, Lisa, is, I think hospice originally started out as a program for people with cancer.
Sure.
And so a lot of times people will say, well, John, my husband has Alzheimer's. but he doesn't have cancer, so hospice would not be appropriate. And yet, Alzheimer's is also a terminal disease, and if you're far enough along in it, it might qualify under that 6-month mark.
Yeah. Well, there's still a lot of areas we'd like to talk about with you about hospice and some of the benefits it can bring into your home and for that loved one that may be aged or ill. And so stick with us after this break and we'll talk about that.
Hi, I'm John Ross, elder law attorney and board member for the Alzheimer's Alliance, and welcome to Our Place. Our Place is a day program designed to provide rest and relief for the caregivers of people with Alzheimer's and related dementias. Our Place is a safe environment where our friends benefit from socialization in a home-like environment. Alzheimer's is devastating and affects over 17,000 families in our area. To find out how Our Place can benefit you, please visit our website.
With my dad, it was in a hospital setting, and in his situation, he fell into renal failure. He also helped us make the decision to be on hospice. I have to admit, it took a huge weight off our shoulders for him to be willing. That offered us a lot of comfort, along with the hospice company itself, but it gave us closure, and it helped us through the entire process.
SEMA Hospice, comfort and care when it matters most.
As things get older, they require more care. This car and I have seen a lot of miles together, but because I take care of her, she runs just like she did in 1955. That's why I chose the Wadley Senior Clinic, with an individualized care plan designed just for me and a convenient location off Jefferson Avenue. They have everything to keep me running like new. It's not about the miles, it's about the journey. Let the Wadley Senior Clinic keep you happy, healthy, and cruising down the road of life.
Hi there, I'm Larry Sims. It's been my privilege for the past several years to be a volunteer board member of Hospice of Texarkana, and there I'm able to represent community members like you. We continually customize our end-of-life care to better meet the needs of our community. As an example, our medical director and nurse practitioners still make visits to homes and facilities. Call today to learn more about the help we can give your family. Hospice of Texarkana, the nonprofit hospice established in 1985 for the community, by the community.
Welcome back to Aging Insight. I'm John Ross here with Lisa Shoalmire, and today we're talking about a relatively underused program out there that most people have heard of, and that's hospice. And there's lots of different hospices out there. A lot of times people will refer to hospice as an organization. The word hospice just means a type of care that is covered under Medicare that is for people who have a terminal condition. And again, as we said before the break, it doesn't mean that you're going to die tomorrow, but there's a number of benefits that can be available under there. There are lots of different hospice organizations. There's private companies that are for-profit. There are non-for-profit companies. But all of these programs are providing services that are paid for under Medicare. And, a lot of things that they can do that, you think about, for example, like having that nurse come out to the house or that nurse's assistant come out to the house to do some things for you. One of the benefits that I think is pretty neat is the respite benefit under hospice.
Right. And respite, what we're talking about is respite for that family, for that caregiver, generally speaking. So the respite benefit for hospice is where the patient, the person who is ill, can actually be admitted to a hospital or another type clinic situation where they can stay there for up to 5 days, and that gives the caregiver who is on the job 24/7, at home, a little break.
Yeah, and a lot of times people don't realize the toll that being a caregiver takes on somebody. The average life expectancy of a caregiver is oftentimes less than the life expectancy of the person they're caring for. And that's because the stress is so difficult. So imagine you're taking care of this family member who has late stage Alzheimer's, and that's a round the clock job. They don't sleep on a regular schedule. They're up and down during the night, and you're trying to take care of them and make sure everything's good, and you're doing your best. But you've got a daughter or a grandchild who's getting ready to graduate from college. And you're thinking, there's no way I can take my husband with Alzheimer's down to College Station to go to this college graduation, but I just hate to miss it. But I can't really afford $160 a day at the nursing home. So what can I do? Well, this is where that respite stay, again, a person with late stage Alzheimer's may very well be eligible for hospice care. And if they're covered for hospice care, then every so often you're entitled to up to 5 days worth of respite care at something like a skilled nursing facility. And now you've got a way to get down to that graduation. And you may not have ever realized that type of benefit was available from hospice.
Right. And another one of the benefits that we see from hospice, hospice is all about improving the quality of life of the individual who is ill. And a lot of times, we live in a wonderful modern age that has some good pharmaceuticals that can, help us be pain-free, can pump up our appetites, can make us feel better, less depressed. And so those medications can be obtained through the hospice programs, and oftentimes those medications can be obtained and you're not falling into that Medicare prescription donut hole, and those medications are provided through that hospice rather than your prescription benefit.
So it can be a way to get especially pain medicine or other types of medicines that are there. Earlier I used the term palliative.
That was a pretty fancy word.
It's a pretty fancy word, but what that all that means is taking care of, and palliative care, which is what hospice care is taking care of that person in a way that keeps them comfortable and happy. One of the last things about hospice here is that they have a huge team of people. And sometimes the benefits that those team members provide can be fantastic. And I want to give you an example or two of how those team members have impacted lives, but you're going to have to stick around. We've got one more break, and when we come back from that break, I'm going to talk to you about those particular issues.
All our moments should be cherished. SEMA Hospice provides comfort care when you need it most with compassion, dignity, and respect. Along with Jordan Health Services, SEMA Hospice provides compassionate continuity of care. SEMA Hospice, comfort and care when it matters most.
As things get older, they require more care. This car and I have seen a lot of miles together, but because I take care of her, she runs just like she did in 1955. That's why I chose the Wadley Senior Clinic with an individualized care plan designed just for me and a convenient location off Jefferson Avenue. They have everything to keep me running like new. It's not about the miles, it's about the journey. Let the Wadley Senior Clinic keep you happy, healthy, and cruising down the road of life.
Hi, I'm John Ross, elder law attorney and board member for the Alzheimer's Alliance, and welcome to Our Place. Our Place is a day program designed to provide rest and relief for the caregivers of people with Alzheimer's and related dementias. Our Place is a safe environment where our friends benefit from socialization in a home-like environment. Alzheimer's is devastating and affects over 17,000 families in our area. To find out how Our Place can benefit you, please visit our website.
From our first moments to our final days, life's journey should be remembered free of burden and worry. Family should be cherished. SEMA Hospice provides comfort care, dignity, and respect. Learn more about SEMA Hospice at SEMAHospice.com. SEMA Hospice, comfort and care when it matters most.
Welcome back to Aging Insight. And Today, Lisa and I are talking about hospice benefits. And, we've talked about that, there's a medical care benefit there, that it's there's a respite benefit, that there's some prescription drug benefits, all within this hospice. But, one of the big things and one of the most valuable things is that the team of people that a hospice agency brings to the table.
To your doorstep.
To your doorstep. That's it. Yeah, that's exactly right. And not just medical professionals like nurses and doctors, but also things like social workers, chaplains, and a lot of times these folks can identify problems long before they ever become problems. And I'll give you an example. We had a husband and wife, and the wife had Alzheimer's. The husband, unfortunately, had cancer, and he was at the very end of his life. And they, as so many people had done, they waited until the very end, and they brought in the hospice people. And one of the things the social worker said was, well, by the way, have y'all thought about what you're going to do for this surviving spouse after, because mom has Alzheimer's, she can't take care of herself, and when dad dies, there's not going to be a caregiver. And maybe you should do some things. Maybe you should put some plans together. And they were actually able to get with us. And, we kind of jumped into action to put some things together so that the surviving spouse would be taken care of, long after that gentleman passed. Now, all of that happened within a couple of days. And frankly, if it had been probably one day later, we wouldn't have been able to complete that task. And I guess my point with that is, kind of goes back to, with all of those resources and all of the knowledge and benefits that those people can provide, don't wait until the last minute.
Well, John, another benefit of hospice that a lot of folks aren't aware of is that hospice benefits and hospice services can also be brought into a nursing home or skilled nursing facility for your family member. And a lot of folks think that if your family member is a resident at the nursing facility, then hospice is not available. But that's really not true. And what's great about bringing hospice into the nursing facility is now we just have that many more eyeballs on that patient to make sure they're just getting the highest and best care, and they're as comfortable and as well taken care of as they can be. So, I've seen families who didn't realize that was a benefit, and when they brought hospice into the nursing facility, their loved one just got all that much more care, and it was it's a difficult time, but lots of support.
Right. So just, I guess our main point today with this topic is that when it comes to hospice care, again, it is truly an underutilized service. It doesn't cost you anything because it's already being paid for by your Medicare premiums. It can be a tool that keeps you out of a nursing home. What do we always say, Lisa, that our clients always tell us that they don't want to go to a nursing home. Well, if you want to avoid a nursing home, don't forget that there may be benefits from hospice that can do that.
That can help you and your family keep you at home.
That's right. And people will say, well, I don't want to be a burden on my friends and family. And here where you've got this team of social workers, nurses, chaplains, CNAs, and all of these different people that they can bring in to help, that does alleviate the burden. That respite stay benefit alleviates that burden so that you're not becoming a burden on others. And of course, again, whether if you're on Medicare, this is paid for by Medicare. If you're on Medicaid, hospice is paid for by Medicaid. So you're not out of pocket. And since you're not out of pocket for these things, if you didn't have that, you might be paying for that person to come to the home to help bathe you or to do those tasks. And so preserving those precious assets by utilizing every service that you can get your hands on That's really the key.
Well, and the bottom line here is, hospice is designed to help support that patient, to have that quality of life. And oftentimes people put off utilizing hospice way too long. And I can't tell you how many times I've heard from clients and their families that they wish they had started utilizing hospice much earlier, because the person that is on the service got to feeling better, because they got their medications, just right. And it really kind of gave them a quality of life during that period that they could enjoy with their families.
Yeah, and my last little point on this, and this is probably the one to keep in mind. Let's say you sign up for some hospice benefits, but you're just not happy with it. Quit. Stop. Just because you've made a decision to take some hospice benefits doesn't mean that you're just washing your hands of life, and that there's no going back. And if you decide, well, you know what, hospice is not right, I'd be better off with home health or paying for some care or maybe some other form, that's fine. So again, use the tools that are out there the best way you can. And you've got to know what those tools are. And of course, that's the point of this program. That's why you've been watching, is so that you can learn what those benefits are and know that they're available even sometimes when you don't think they're available. Don't just believe rumors out there. Get the real knowledge. Get the benefits that you need to take care of yourself.
Yeah. So we've completed another episode of Aging Insight, but we're here every week on KLFI. And you can also go to the KLFI website. If you missed last week's episode, you can hit that website and you can get a replay right there. And you can catch us on the radio every Saturday at noon on 107.1, where you can call in with your questions.
Yeah, that's live call-in radio. So if you have a question, call us. You can also find us on the internet at aginginsight.com, on Facebook, and you can follow me on Twitter at TXKElderLaw. And until next time, we'll see you.
Goodbye.
Thank you for joining us for this week's Aging Insight program with John Ross and Lisa Shoalmire. This program is made possible by